Welcome back to our channel. Today, we have an important topic to discuss, the life-saving treatment known as anti-tetanus serum. So, let's jump right in. What is tetanus? Tetanus, also known as lockjaw, is a serious bacterial infection caused by the bacterium Clostridium tetani. This bacterium is commonly found in soil, dust, and animal feces. It enters the body through open wounds, especially deep puncture wounds. Once inside the body, the tetanus bacteria release a toxin called tetanospasmin, which affects the nervous system. This toxin binds to nerve endings and interferes with the normal transmission of signals between nerves and muscles, leading to muscle stiffness and spasms. Tetanus is a medical emergency, and if left untreated, it can be fatal. The good news is that we have a highly effective treatment called Anti-Tetanus Serum, or ATS, which plays a crucial role in preventing and treating tetanus. What is anti-tetanus serum? Anti-tetanus serum is a specific immunoglobulin that contains antibodies against the tetanus toxin. It is derived from the blood of animals, usually horses or humans, that have been immunized against tetanus. The serum is used as a treatment for tetanus, a bacterial infection caused by Clostridium tetani. When administered to individuals at risk of or already affected by tetanus, the anti-tetanus serum helps neutralize the tetanus toxin, preventing further damage to the nervous system. Tetanus antiserum provides immediate passive immunity, buying time for the patient's immune system to produce its own antibodies and effectively fight the tetanus bacteria. How anti-tetanus serum produced? Tetanus antiserum, also known as anti-tetanus serum or ATS, is produced through a process involving the immunization of animals, usually horses, and subsequent collection and purification of their blood plasma. Here is a brief overview of the production process. Immunization. Horses are immunized against the tetanus toxin by administering small, controlled doses of the toxin. This stimulates the horse's immune system to produce antibodies specific to the tetanus toxin. Antibody production. Over a period of time, the horse's immune system generates a robust immune response and begins producing large quantities of antibodies against the tetanus toxin. Blood collection. Once a sufficient antibody response is achieved, blood is collected from the immunized horses. This is typically done by drawing blood from the horse's jugular vein using sterile techniques. Serum separation. The collected blood is then processed to separate the serum from the other blood components. This separation is usually achieved through a process called centrifugation. Purification. The serum undergoes a series of purification steps to isolate and concentrate the antibodies specific to the tetanus toxin. This process involves techniques such as precipitation, filtration, and chromatography to remove impurities and unwanted components. Testing and quality control. The purified serum undergoes rigorous testing to confirm its safety, potency, and efficacy. This includes testing for the absence of pathogens, such as bacteria or viruses, and verifying the concentration of tetanus antibodies. Packaging and storage. Once the serum passes the quality control tests, it is packaged into vials or ampules in sterile conditions. Proper labeling and documentation are ensured, and the serum is stored under controlled temperature conditions to maintain its stability and effectiveness. It's worth mentioning that in recent years, alternatives to animal-derived tetanus antiserum, such as human tetanus immune globulin, TIG, have also been developed and used in certain cases. These alternatives involve collecting plasma from human donors who have been immunized against tetanus or have high levels of tetanus antibodies. When tetanus antiserum administered. Tetanus antiserum, also known as anti-tetanus serum or ATS, is typically administered in specific situations where there is a risk of tetanus infection or to individuals who have already been exposed to tetanus. Here are the common scenarios when tetanus antiserum is administered. Suspected tetanus infection. When a person presents with symptoms suggestive of tetanus, such as muscle stiffness, spasms, and difficulty swallowing, healthcare providers may administer tetanus antiserum as part of the immediate treatment. This is done to neutralize the tetanus toxin and prevent further damage to the nervous system. Wound contamination. If an individual sustains a deep or dirty wound that carries a risk of tetanus infection, such as a puncture wound or an injury caused by a contaminated object, tetanus antiserum may be administered as a preventive measure. Treatment with tetanus antiserum is particularly important if the individual has an incomplete or uncertain immunization history or if it has been more than 5 years since their last tetanus vaccine. Tetanus-prone injuries. Certain types of injuries are considered high risk for tetanus, regardless of immunization status. These include injuries involving soil, animal bites, burns, or wounds with necrotic tissue. In such cases, tetanus antiserum may be administered as a precautionary measure, even if the individual has received recent tetanus vaccinations. Additionally, tetanus antiserum is often given alongside other necessary treatments, such as wound cleaning, antibiotic therapy, and tetanus vaccination, to ensure comprehensive management of the infection and to support the individual's recovery. How tetanus antiserum work? Tetanus antiserum, also known as anti-tetanus serum or ATS, works by providing immediate passive immunity against the tetanus toxin. Here's how it functions. Neutralizing the toxin. Tetanus antiserum contains specific antibodies that can recognize and bind to the tetanus toxin produced by the bacterium Clostridium tetani. These antibodies effectively neutralize the toxin, preventing it from causing further damage. Blocking toxin receptor interaction. The tetanus toxin acts by binding to specific receptors on nerve endings, interfering with the normal transmission of signals between nerves and muscles. When the tetanus antiserum is administered, the antibodies bind to the tetanus toxin, blocking its interaction with the nerve receptors and preventing further neurological complications due to toxin. Passive immunity. The administration of tetanus antiserum provides immediate, temporary immunity to individuals who have been exposed to or are at risk of developing tetanus. The antibodies in the antiserum act as a temporary defense against the toxin until the individual's immune system can produce its own antibodies against tetanus toxin. Facilitating recovery. By neutralizing the tetanus toxin, the antiserum helps to limit the progression of the infection and minimize the severity of symptoms. This allows time for the individual's immune system to mount an effective response, producing its own antibodies against the tetanus bacteria and supporting the process of recovery. Potential side effect of anti-tetanus serum. While tetanus antiserum, also known as anti-tetanus serum or ATS, is an important treatment for tetanus, it does carry the potential for side effects. These side effects can vary in severity and individual response. Here are some potential side effects of anti-tetanus serum. Allergic reactions. Allergic reactions are possible with any medication or serum, including anti-tetanus serum. These reactions can range from mild to severe. Symptoms may include itching, rash, hives, swelling of the face, lips, or throat, difficulty breathing, and in severe cases, anaphylaxis. Allergic reactions require immediate medical attention. Serum sickness. Serum sickness is a delayed hypersensitivity reaction that can occur a few days to a couple of weeks after receiving anti-tetanus serum. Symptoms may include fever, rash, joint pain, swelling, and general malaise. In most cases, serum sickness is self-limiting and resolves without complications. Transmission of infectious agents. Although stringent measures are taken during the production and purification of anti-tetanus serum to minimize the risk of transmitting infectious agents, there is still a small possibility of transmitting certain viruses or other pathogens. However, the risk is generally considered low due to the purification process and the strict screening of the animals used for serum production. Other side effects. Some individuals may experience mild side effects such as local reactions at the injection site, including pain, redness, or swelling. These reactions are usually temporary and resolve on their own. It's important to note that the benefits of anti-tetanus serum in treating tetanus is much more than its side effects. Healthcare professionals who administer anti-tetanus serum are trained to monitor patients closely for any adverse reactions and take appropriate measures if needed. Conclusion. Anti-tetanus serum is a crucial component of tetanus treatment, as it provides immediate passive immunity and helps in the management of the tetanus infection. It buys time for the patient's immune system to produce its own antibodies and fight the bacteria effectively. Remember, prevention is always better than cure. Keeping your immunizations up to date, especially with the tetanus vaccine, is the best way to protect yourself from this potentially deadly infection. If you sustain a deep or dirty wound, seek medical attention promptly, as early intervention can prevent the development of tetanus. That's all for today's video on anti-tetanus serum. I hope you found this information helpful and informative. Stay safe, take care of your health, and remember to subscribe to our channel for more educational content. Until next time, goodbye.